Hello and welcome back. I'm Shubham Thakur and I'm excited to continue our journey through the revenue cycle. In previous videos, we covered patient intake, documentation, claim submission, and analytics. Today, we're stepping back to explore an essential part of the healthcare ecosystem, the payers. Understanding how Medicare, Medicaid, and commercial insurers work will help you navigate eligibility, billing rules, and reimbursement rates.
All right, so let's get right to it. When you boil it all down, the entire revenue cycle hinges on two really simple but absolutely critical questions. Who's actually paying for this? And maybe more importantly, what rules do we have to follow to get that payment? You know, getting this right from the get-go is the secret to a smooth, healthy revenue cycle. But here's the tricky part. Every single payer, well, they've got their own rulebook.
So, here's how we're going to tackle this today. We've broken it down into 5 key parts. First up, we'll talk about why knowing this stuff is so crucial. Then we'll dive deep into the big 3 payer types, Medicare, Medicaid, and commercial insurance. And to wrap it all up, we'll put everything together and see how these different rules actually play out in the real world.
So let's start with the big why. Why does this all matter so much? Well, it's pretty simple. The payers literally write the rulebook. They're the ones who decide who's covered, what services they'll pay for, and the precise step-by-step process you have to follow to get a single dollar. If you miss a step, the whole claim can just crumble. It's really the foundation of every clean claim.
And if that foundation is shaky, the fallout is immediate and expensive. When you don't follow a payer's specific rules, you're pretty much guaranteeing a claim denial. That means more work for our team to fix it. It means payments get delayed, which messes with cash flow. And, something we should never forget, it can really frustrate our patients when they get a bill they weren't expecting. That's a bad experience for everyone. All right, let's kick things off with one of the giants of the industry, Medicare. Think of Medicare as the national health insurance program. It's run by the federal government, and that's a key detail, because it means the rules are standardized pretty much everywhere in the country.
So who does Medicare cover? Well, it's mainly for people who are 65 and older, but it also provides coverage for some younger folks with specific disabilities or certain conditions. The big takeaway here is that when you're handling a Medicare claim, you're operating under one consistent national set of rules.
Now, Medicare isn't just one single thing. It's broken up into different parts. You've got Part A for hospital insurance, Part B for medical stuff like doctor's visits, and Part D for prescription drugs. But here's the one you absolutely have to pay attention to for billing. Part C. This is what's called Medicare Advantage. These are plans run by private companies, and this is so important. You have to know if your patient has original Medicare or a Medicare Advantage plan. Why? Because the billing rules, the networks, the need for authorizations, they can be totally different.
And here's a perfect real-world example of a Medicare rule. Let's say you're about to provide a service, and you think Medicare might not pay for it. In that case, you are required to have the patient sign something called an Advanced Beneficiary Notice, an ABN. This little piece of paper is proof that you told the patient they might be on the hook for the cost. Now, if you forget to get that signature and Medicare denies the claim, you can't bill the patient, period. That money is just gone, forever.
Okay, let's shift gears to the next big government payer, Medicaid. And if you remember one thing about Medicaid, make it this. It's a partnership. While the federal government helps pay for it, each state runs its own program. And that single fact is the biggest difference between Medicaid and Medicare. So who is Medicaid for? It's designed to give healthcare coverage to millions of low-income Americans. We're talking adults, kids, pregnant women, and folks with disabilities who meet their state's income requirements. So right away you see the difference. Medicare is mostly about age, but Medicaid is all about income. And because each state is in the driver's seat, the rules are all over the map. What it takes to be eligible, what services are actually covered, the specific billing codes you have to use, it can all be completely different from one state to the next. Seriously, a procedure that's fully covered for a patient in Texas might be flat out denied for a patient from Oklahoma. This state-by-state difference, that is the absolute most critical thing you need to understand about Medicaid.
Now, to make things a little more interesting, some patients can actually have both Medicare and Medicaid. They're often called dual eligibles. When you have a patient like this, there's one simple, unbreakable rule. Medicare always pays first. You send the bill to Medicare, they pay what they're going to pay, and then Medicaid steps in as the secondary insurance.
Here's a classic billing error that happens all the time with Medicaid. Imagine our clinic is used to billing a certain procedure code for our local, in-state Medicaid patients. We know it gets paid every time. But then, a patient from across the state line comes in. We use the exact same code, send in the claim, and bam, denied.
Why? Because that other state's Medicaid plan doesn't cover it. This is exactly the kind of thing that causes so much extra work and slows down payments.
All right, on to our third and by far largest category, commercial insurance. This is basically the catch-all term for any health plan that isn't Medicare or Medicaid. We're talking about all the private companies you've heard of, the Blue Crosses, the United Healthcares, the Aetnas of the world.
So where does the money for these plans come from? Well, it's from premiums, which are paid either by a person's employer or by the person themselves. The most common way people get commercial insurance is through their job, but you can also buy a plan on your own, like from the health insurance marketplace.
Now, in the commercial world, you'll see a bunch of different types of plans. But the two big ones you'll run into constantly are HMOs and PPOs. For us in billing, the biggest difference is all about the network. HMOs are usually pretty strict. You have to stay within their network of doctors, and you almost always need a referral to see a specialist. PPOs, on the other hand, give you more freedom to choose your doctors. But if you go out of network, it's going to cost the patient more. That's why checking the plan type is just so important.
Pay close attention to this one, because it is probably the single most common and most expensive mistake you can make with commercial insurance. It's called pre-authorization. This means for certain services, you have to get the insurance company's permission before you do anything. If you skip that step, if you don't get that authorization number, they have every right to deny the entire claim. And a lot of the time, that's money you'll just never see.
Okay, so we've looked at Medicare, Medicaid, and commercial plans on their own. Now let's put them all side by side. This is where you can really see the big picture differences.
Just looking at this chart, the whole system starts to make more sense, right? You've got Medicare. It's federal, it's for people 65 plus or with disabilities, and the rules are the same everywhere. Then there's Medicaid, that federal and state partnership based on income, where the rules change state by state. And finally, commercial insurance, all based on private contracts. You get it through work or buy it yourself, and every single plan has its own unique rules and negotiated rates.
So how do you actually use this information every single day? Think of it as a simple 3-step checklist you run through for every single patient. Step 1, just identify the main payer type. Is this Medicare, Medicaid, or a commercial plan? Step 2, get specific. Is it a private Medicare Advantage plan? Which state's Medicaid are we dealing with? Is it an HMO or a PPO? And step 3, confirm the rules for that specific plan. Is an ABN required? Do we need to get a pre-authorization? I promise you, if you follow these 3 steps every time, you will save yourself and our team a world of trouble.
You see, figuring out the payer is always step 1. It sets the stage for everything else you need to do. The real question is, are you ready for step 2? Understanding the basics of Medicare, Medicaid, and commercial insurance is foundational for anyone working in revenue cycle management. Knowing who pays the bill and under what rules allows you to verify coverage accurately, capture the right information up front, and avoid costly mistakes. In our next video, we'll zoom in on payer policies and benefit verification, how to confirm eligibility, interpret benefits and exclusions, and navigate prior authorization requirements. Until next time, thanks for watching. Don't forget to like, subscribe, and leave your questions in the comments.